I co-wrote a chapter a few years ago, and that really focused on unconscious bias. And I think that so many people, for many people generally, and researchers as well, can, without even realizing it, have this assumption of incapability, have this the stereotypical model of a person with dementia firmly in the back of their minds, and and that's what many of us try to reinforce, or not reinforce, but to correct through presentations, conversations, whatever, is that you can't assume incapability, that everybody is an individual. And so there is that need to get to know people as individuals. Um, I remember a conference talking about um, sort of interviews, if you will, people to join a research project. And I think it had something to do with 10 cups of tea. And and that's a lot of it, is just understand who they are, understand their capabilities. Uh, and that really boils down to listen and learn. I have said that many times, that um, listen, and make sure you do listen before responding, to really learn from each other, to um, as Allison said, she came away from many meetings going, I learned something new. And so many people generally, and researchers, don't don't necessarily believe that that would happen. Um, and it just becomes, for researchers, I'm so busy focusing on the project, trying to, collect data and so on. Do I need this added frustration? Do I need this added piece of learning? How to work with an individual with dementia? Um, Thinking, of course, the worst possible aspects for them. And so give it a whirl. Trust your gut, and but definitely leave your biases behind. Leave them at the door, and um, don't don't engage first with that preconceived notion. Um, and my guess my last point is really, don't don't treat the engagement of people with dementia as a tick in the box. If you're going to do it in a meaningful way, realizing and accepting that they will be capable of making a contribution.